Hey guys, welcome to my channel at Peds Nurse Danny. I'm hopping on real quick just to discuss pediatric nursing and talking about if you are in nursing school or thinking about being a nurse, why you should consider pediatric nursing, and kind of talk about the key differences between pediatric nursing and adult care. I'll speak for myself. When I was coming out of nursing school, I was terrified of caring for children. I had a placement in the PACU, which is the post-anesthetic care unit. And every time we had a child post-op who was like a dental extraction or some other small procedure, I would be so nervous because I felt like you could never quite predict how a child would react coming out of anesthetic. Their anatomy is different, their physiology is different, the way they react to medications is different. So everything seemed like it was a lot more intense. But to be honest, after I got my job at the pediatric hospital where I work, I quickly fell in love with pediatric nursing, and I cannot imagine going back to adult care. So there are a lot of good things about working in peds. You really learn to challenge yourself too. So things to think about as a nurse is, drug dosage calculation. Kids have meds based on weight. So there's lots of calculations that you have to be able to do. Most institutions have a calculator, like our system has a calculator where you type in the patient's weight, and all the emergency resuscitation meds are calculated for you on the sheet. You should still always be doing your double checks though, and making sure that it is correct. And a lot of places have a binder with pre-printed weights on it for a quick resource, especially hospitals that are kind of outside of the major cities, and they actually use resources from my hospital that I work, because we're a big center, and we do a lot of outreach where we go out and teach nurses and doctors about kind of the methods that we use in the larger center. So that's one thing to think about. That kind of makes some nurses and nursing students nervous, but it is something that you get used to. Second thing, you do have to think about, you're not just dealing with the patient, you're dealing with the parents. So obviously that can be challenging in some ways, but also can be wonderful. So it's a really patient-centered, family-centered approach that we do. And yeah, you just kind of take the good with the bad. I loved seeing how resilient children can be. A super sick kid would come in and walk out the door the same day after like an asthma attack, after we initiated our treatments. It was amazing. Also, we see on the opposite end very tragic things. So you kind of have to take the good with the bad and kind of see what kind of personality you have to be able to handle all these different types of scenarios. But yeah, if you guys have any comments, please comment below and subscribe to my channel. More content coming soon. Thanks.